Welcome to this Aspiring Medics tutorial on knowing your medical school. My name's Luke, and in this session, we're going to look at an introduction to some of the teaching methods that you'll see in your medical schools. So firstly, we're going to look at medical school teaching methods in the UK. Then we're going to look at what might appeal to you about each of these methods, then how to answer a question on teaching methods. And finally, we're going to finish with some Aspiring Medics top tips. So teaching methods are overarching teaching methodologies that medical schools follow. And although the content covered at medical schools is pretty standard, its method of delivery will vary, and this will depend on the teaching methods of the school. So the experience can really vary between different medical schools with different teaching methods. So your experience can therefore depend on the medical school's teaching style. So say, for example, one key difference between different teaching methods is clinical exposure. So some traditional courses do not start proper clinical exposure to year 4. However, some different medical schools will have clinical exposure from day 1. So it's really worth getting an idea about some of these different teaching methods and your experience with them, because you will have a very different experience of medical school between some of these different teaching methods. And you also need to think about your priorities. So you need to think carefully about your priorities and what your ideal medical school looks like. So how do you learn best? Do you learn better hands-on, or do you learn better in a theoretical sense? Are you more interested in the clinical or the scientific side of medicine? So these are all questions you need to ask yourself before you look at some of the teaching methods that are available at different medical schools. So we're going to think about some of these teaching methods through the question, what appeals to you about this medical school's course? So this is a question that you need to be prepared to answer. So it doesn't have to only encompass teaching methods. It can involve many different things, such as content or facilities, but you should also address the teaching methods as that is a really important part of most medical schools' curriculum. So one teaching method is case-based learning or problem-based learning. So they're relatively similar things, however, there's slight differences between them. And so there'll be individual videos on each of these. So this is just a brief introduction to all of these. So you've heard some of the terminology before. So case-based learning or problem-based learning is deemed to be more patient-centric with an emphasis on small group teaching and problem solving. So some differences between PBL and CBL. So PBL, that's problem-based learning, is based around specific medical problems, and you are guided through these by tutors. So you'll get a problem together as a small group, you'll work through them, you will then go and look at some lectures or some seminars or some teachings or some readings that might be able to help you solve this central problem that you were given, and that's how you'll learn your content. So case-based learning, CBL, has similar structures such as this. So you're still having these cases that you need to solve, but it's more heavily based on seminars and lectures. So it's a little bit more traditional. What other medical schools or what other universities might look like. And one key benefit that lots of people see in PBL or CBL is early clinical exposure. So the emphasis is on patient-centered teaching, and you have early clinical exposure. So this is one benefit that you could discuss in your interviews. So another teaching method is integrated. So this involves the teaching of scientific basis of medicine alongside clinical training. And often you will approach your medical content in this teaching method in a system-based manner. So instead of looking at physiology and then biochemistry and then anatomy, you'll take one system, say, for example, the cardiovascular system. You look at the biology, physiology, anatomy, biochemistry, and clinical methods all at once. So you do a chunk of the body and you cover everything on that body, and then you move on to the next bit. So many would consider the integrated course as the best of both worlds because it blends clinical and scientific, and it's a teaching method that's recommended by the GMC. And I would say the majority of med schools are integrated, but you can also incorporate some PBL or CBL, so that's problem-based or case-based learning into this. And it, integrated reflects more of the modern medical landscape, modern medical practice. So especially in larger teaching hospitals, which are sometimes more scientific focused. So that's a little summary of integrated. And finally, there's traditional courses. So traditional courses are much more rare. So they have a medical course that's split very definitively into preclinical and clinical components. So you're effectively doing a medical sciences course and then a clinical medicine course. So in the UK, only Oxford and Cambridge offer this teaching methods, and it's really, really good if you have a strong scientific grounding. For those who love the science behind medicine, this is a really, really good course structure for you. So this is what I've slightly mentioned here. So PBL and case-based learning, problem-based and case-based learning, sorry, and integrated teaching styles aren't mutually exclusive. So a course can be integrated, so it can have that scientific focus and it can have that clinical focus, but also you could be integrating in this problem-based approach. So you could be having problems and cases that you're solving together. So that's something to keep in mind and maybe to mention in interviews or to keep aware of when you're looking at medical schools. So we looked at medical school teaching methods in the UK. We've looked at what might appeal to you about each of these methods. And now we're going to look at how to answer a question on teaching methods. So here's some features that you might want to look at when you're approaching the question. So you want to look at some background knowledge. So you want to look at the teaching method that's used. You want to look at the benefits of the teaching method. Say, for example, if you're looking at PBL or CBL, if you're answering a question on that, you'd say there's more clinical exposure. You'd maybe bring in your own personal preference. Say, for example, in your work experience, you've really enjoyed patient contact and interaction, and you'd want that from very early on. Why you would suit it, again, this is PBL, you've got really strong communication skills, and you think that's, that working with members of your medical school and tutors on a problem or a case might be a really useful way to approach this. You might also look at some other aspects. So we've mentioned that you don't only want to focus on teaching methods, you also might want to look at societies in the university or the facilities of the university, or maybe some of the content. And remember to be honest. So in this, it will make your answers a lot stronger. And universities are also very well practiced at seeing people who might not be telling the complete truth. So make sure to really be honest about why you want to go to this university. Make sure to really do your research as well into the university, as that will really strengthen your answer. So now we're going to look at some aspiring medics top tips. So again, be honest. Universities will know if you're not, and you will score more highly speaking with honesty because your answers will be more genuine and more strong. Read around the topic, so you can use our website, theaspiringmedics.co.uk, and know your university. It's a relatively easy thing to do, and it's really important to know how to answer any of these questions on the university or the medical school or their teaching style, as you know, it's one that will probably come up, and it's a really, really easy one to be prepared for if you do your research. So we've looked at some medical school teaching methods in the UK. We've looked at what might appeal to you about each of these methods. We've looked at how to answer a question on teaching methods, and we've looked at some aspiring medics top tips. So that's a brief introduction to teaching methods in medical schools in the UK. And in future videos, we're going to look at each of these teaching methods individually and go a little bit more into depth into the advantages and disadvantages of these.
To unlock the rest of the videos in this category, make sure to purchase the Aspiring Medics online interview course. We have over 50 videos covering 7 categories, including COVID-19, the NHS, and medical ethics. Head on over to www.theaspiringmedics.co.uk today to ace your med school interview.